So I'm going to, can you hear me now?
Yeah, that's good.
So I'm going to ask you a question that, if you could answer it, that would be amazing, because it would like solve like 10 years of problems. But at the end of the last session, we had a clash between, thinking about things in a very strict sort of regulatory legal space versus thinking of the social and cultural history of mental health and what the different things are that you worry about when you have those two perspectives. And I think that with digital technology, we're building new models for mental health. We're building new classifiers. We're building new features. And there's a danger that we're going to build them on the populations that we traditionally build our science on, which is mostly Caucasian, mostly higher socioeconomic status, mostly higher education. But there's people with data in this room, so Christoph Gaius right here, for example, that these fundamental things like keystrokes and latencies of reaction times in a kind of sort of app-based environment that you're building at Mindstrong Health, those things vary across cultures in pretty significant ways, right? Am I just, yeah, right? That's true? So, so what do we do about that?
So, Laura, I'm not sure that I worry about that as much as you might. I mean, I think that's absolutely true for all the other sorts of innovations we've been after, but it's just stunning to me how, as I said in one of the slides, smartphones are now more ubiquitous than clean water or than stable electricity. They're everywhere, and they're more ubiquitous every month or every year. And I don't buy the idea that there's a digital divide based on zip code or socioeconomic status. There is a digital divide by generation, and I'm an example of that. I don't use my smartphone for a lot of typing. So, I have the Mindstrong app. It's pretty useless for me because I do my typing on a laptop, which we don't capture. But that's less true for people under the age of 30, and it's certainly less true for people under the age of 18. So whether the actual use of the phone in different cultural, ethnic, geographic, socioeconomic groups is different in terms of those kinds of keystrokes, that's a great scientific question we can begin to engage in. We'll have that data to be able to actually understand how these things vary across cultures, across different groups. We're already, we see this as a global platform, so we're already looking at how to do studies in Asia, across Europe, and hopefully eventually in the Southern Hemisphere as well. That hasn't happened yet, but I think the opportunity is there more than it would be for any other platform that we've had. So I'm pretty intrigued that this is actually a great democratizer rather than something that will increase the disparities. Does that, am I Pollyannish about that? I mean, I'd love to hear other people's thoughts about it, but I just think compared to everything else that we've had as an opportunity, this is like the first time you could say, wow, we can, we've got something that truly is global and is used so broadly. It's used so much that most people think it's the problem and not the solution. Justin, you want to get into this discussion?
So I'll throw out another sort of provocative question. In my talk yesterday, I quoted from George Engel's piece on the biopsychosocial model. One of the things he gets into there is sort of who are the appropriate people to treat mental problems? Are they doctors? Are they priests? Are they community members? Where are the solutions going to be for this? Is it going to be from healthcare? Is it going to be from software companies? I think a lot of people struggle. Industries. Should I make a product that's a healthcare product because that's going to come with certain regulations, certain expectations? Should we just be promoting apps that are not healthcare, but they provide some relief to symptoms? How do you think about this? I mean, presumably it's not one thing, but I think it seems like the direction we go is going to affect that whole regulatory framework and the kinds of solutions that are considered off limits, in traditional frames. I'm just curious.
Yeah. So the first thing to say is there is no regulatory framework, right? So we're all in the Wild West, and that's part of why I'm so concerned about this ethical, legal, social stuff, because if we don't do this, it's going to be done to us, and because the FDA they're not going to play in this space, so we've got to get serious about creating some standards for privacy, for quality, for efficacy, all that. Cyber Guide's trying to do that, but we probably all need to be involved. You know, I don't know that I have a good answer to your question about the angle issue of like who's going to be actually doing this. I think we're in this space where there's lots of resources, lots of different things out there, and I think consumers are going to try to find what they can. The question for me is like, you know, how much is this going to be done in universities? How much in the private sector? In the private sector, is it going to be small little companies like ours? Is it going to be big companies like Microsoft, Apple, Google? I just wrote a piece in Nature trying to sort of sort this out. A Nature commentary came out last week, trying to just, like for myself, try to figure out how's this going to happen. I do think that what I see a lot, and was even kind of evident here, is that there are a lot of academics who create software, and they do really beautiful RCTs on it. But frankly, the UX and UI is crappy, and it'll never scale to 10 million people. It just can't. It's like nobody likes, people won't fall in love with it the way they fall in love with really good software. On the other hand, you've got companies where you've got great engineering and great design and huge, beautiful interfaces and all that stuff, but they don't have the funding to do really good efficacy studies. So there's no real data on whether what they built actually works or not. And so what I'm calling for is trying to get those groups working together and to have some kind of formal partnerships that will allow each of those, the public and private side, to do what they do best. I do think that the public trust issue, and just in the last 3 months really, is beginning to turn in terms of the attitude in the United States, defined as what the New York Times says, towards the large tech companies. For the first time, there's a lot of concern, mostly because of the Russia issues with Facebook, a lot of concern about the reach and the ethics of the tech giants, and that's partly because they've just been so successful. And we'll have to see how that spills over in terms of is that going to keep those companies from being able to play in the health space at all? But I do, last thing I'll say about this is that we've got to be aware of the hubris of Silicon Valley, and I'll take ownership of this, that just because you can build a social network platform doesn't mean that you can fix education or healthcare. And many of the companies assume that they've got lots of money and lots of smart people, and so they can move into healthcare the way they've moved into entertainment and commerce and shopping and everything else, and this will be just another place that they can transform. Not so easy. I think we're finding that, and that's really why I did the Nature piece. And I hope they're successful in disrupting this. But so far, I wouldn't say. I think they're all learning this as much. I think there's a U.S. president who said recently, "Healthcare is complicated," and they're beginning to find that out. Andrew?
Picking up on Justin's last question, it seemed to me one of the very important slides you showed is this depiction you showed early on of the development of mental illness early in life. So as a child psychiatrist, I think about this all the time. If we had the means to collect data and to predict and to intervene early on before 25 when people become psychotic, or even before puberty when you start to see the rise of depression, what a more powerful way we could affect people. So it makes me curious about the implications of what you're saying for the school system. After all, we have a system in this country that's designed to have universal access, whether it doesn't quite work, but getting there, that has, for the most part, the trust of the population. But when I did research in kids, it was hard to get into the schools. There was a lot of anxiety about what were you doing to our kids? You're going to try to get them on medicines too early? Are you going to try to use that data in some way? You can ask them about suicide and make them more suicidal. So I'm curious if you have thoughts about these technologies or your technology being involved in the schools and building trust there.
Yeah, it's a great question, a huge problem. We're going to try to deal with that in California, where there's county agencies. We're trying to build some bridges between mental health and education, but the schools are already overloaded and overwhelmed with way too many things to do. The idea of collecting data in the way we're talking about, probably a non-starter in a lot of places. I think we need a few places that will be early adopters. There's a fascinating effort that's just developed globally called Cities Rise, trying to identify some cities that will be incubators for youth mental health, bringing together school systems and mental health programs. I suspect New York will be one of them. We're hoping that maybe Los Angeles would be another. In the United States, there's Nairobi is going to be involved. There's probably be one in Asia. So keep your eye out for that. That'll be an opportunity to at least try some of this out and develop some demonstration projects of bringing school systems and healthcare systems, mental health care systems together. But again, it's kind of like this argument I'm making that, even the general public doesn't want what we have. I know the school systems may not want what we have. We have to come up with a way that's more palatable. I think this, the consumer-built kind of, the 7 cups kind of model might be a lot more attractive and usable. It has been for universities, and it might be for younger kids as well. But stay tuned. I think it's a really important area. Oh, one more question.
Tom, I have an answer for Justin's question.
Good. Does that count as a question?
I gave a talk in China last year on TeleMental Health, and in preparation for it on the plane, I was looking at World Health Organization data on the distribution of mental health professionals by specialty in different countries. I'm sure it's stuff you've seen. And what was interesting about China was that although they had 1/10 as many psychiatrists per capita than the United States, they had 1/100th the number of psychologists and social workers that we have in the United States per capita. And so in talking about using telehealth as a distribution system for providing care to under-resourced areas where there may not be a mental health professional for hundreds of miles, the limitation is the lack of people who could use a decision support system that delivered a model of care that's evidence-based, like cognitive behavior therapy, that could be manualized and distributed. And so I think that for China, the challenge, and I'm sure this is true for many other countries, the challenge is to have a rapid training program that might be at the BA level or equivalent, rather than looking for advanced degrees in which people learn how to use the system and learn and get trained specifically in a certificate program to be able to use a decision support tool that guides care with proper supervision to back them up.
Yeah, great. Well, thanks for that comment. I'm not a betting person, but if I were, I'd be willing to bet at least a 6-pack of imported, maybe even Chinese beer, that the fact that they don't have anything in place is going to be an advantage for them, and that they'll be able to innovate and create, and they're doing this now. Alibaba has just becoming a healthcare company. They bought 8 hospitals in the last 2 months. They're creating clinics all over the country. It's kind of amazing. They're going to be able to build an infrastructure for this without having to take anything out of the way. There's nothing there now. And so they're interested in collaborative care, which is the model that I think we should all be thinking about for how to use technology, and the idea that they could create collaborative care networks by training up people who would serve as care managers with like a 10 to 100, maybe 100 to 1 ratio with specialists like psychiatrists. So very interesting moment in time. I'd watch that space over the next 3 to 4 years, because China understands there's an issue. They care about the problem, and when they focus on something, a lot can happen really quickly. I wish I could say the same thing for the United States, but you never know. With that, I'll turn this back to Justin.